The Medical Humanities module was created in 2008 as part of a curriculum review. And the idea was to bring more experiential learning, student choice and reflective practice into the early years curriculum. We were very clear about the aims and learning outcomes and linking these to the GMC outcomes.
Becoming a doctor today requires a certain level of awareness of the socio-political context, because there are several challenges that our students will have to face once they graduate. Our aim is to nurture medical students to go beyond being simply operators following protocols and procedures in order to become compassionate and empathetic clinicians. By fostering intercultural communication skills, promoting an understanding of power structures and dynamics, facilitating ethical decision-making and raising awareness of planetary health, we also aim to actively contribute to create a healthcare system that embodies principle of social justice.
I think in terms of personal development, students can get a much increased self-awareness and confidence from working in the module, especially when they have to engage with the unfamiliar. For example, working with sound in experimental film or performance skills in theatre. They learn to recognise the vulnerabilities in themselves and others, and this enables them to begin to develop a much more authentic self.
Particularly when you're studying medicine, it's not just about learning about a disease or a condition, but it's also understanding about the background that that person that they're meeting has in relation to their condition. So their psychological backgrounds and the issues for them and their social backgrounds.
I really hope that they think about me not just a case to cure, to diagnose, to consider me as a social person. Try to think, try to reflect that, put yourself on the place of the patient, look at things differently. Thinking about all these sort of things will add more quality to the doctors.
In terms of the module, students choose from a range of options such as art, music, creative writing, philosophy, film, and they then choose a topic that really interests them and use the skills that they've learned in the option to explore that topic. And then they will produce a piece of creative work, which might be a drawing, a theatrical piece, a set of poems, a musical composition, and they will reflect on that experience by writing a reflective account.
So it goes beyond the sort of the scientific and the technical things we're taught in lectures, which are very important, but then it helps us think about the social and cultural factors that influence healthcare, which are also equally as important and are good to put into practice now and in our future careers.
This experience was crucial in order to improve their interactions with patients from diverse backgrounds. As a faculty, we promote a comprehensive understanding of healthcare that combines both the scientific and the humanistic aspects of medicine.
And I think that has made me more in tune to the diverse needs of patients and has made me a more culturally competent medical student and hopefully a more culturally competent doctor.